Welcome back to another episode of HealthCap Weekly Wrap. We're glad you're with us this week because the stories we're covering really reflect what senior care leaders are navigating right now. We're talking about CMS star ratings and transparency, sepsis response and rapid teams, infection prevention strategies from the CDC, new legislation out of New Jersey focused on financial protections for residents, and an FDA drug approval that matters for behavioral health in senior care communities.
Yeah, this is one of those weeks where every story feels like something you could talk about in a leadership meeting tomorrow.
Exactly. These topics show up in operations, clinical conversations, marketing, admissions, and family trust.
So let's start with CMS star ratings. This story comes from the Center for Medicare Advocacy, and it explains how senior care communities can use largely self-reported, unaudited quality measures to inflate their CMS star ratings. The key concern is that high-quality measure scores can significantly boost an overall rating even when staffing levels are poor, which can give families an incomplete picture when they're trying to choose care. The article really questions whether the current system promotes transparency or unintentionally misleads consumers.
Right? Because most families don't know how much of that information is self-reported.
Exactly. Families often see those stars as a shortcut, especially when they're making decisions quickly after a hospitalization or health change. This article isn't brand new, but it's still incredibly relevant because CMS hasn't fundamentally changed how these measures are weighted, and staffing challenges continue across senior care.
And staffing is what residents and families experience most directly once someone moves in.
That's the heart of it. For senior care leaders, the takeaway is knowing the rating system well enough to explain it honestly and thoughtfully. Communities that openly talk about staffing levels, team culture, and care processes tend to build more trust than those that rely on ratings alone.
It's really about setting expectations instead of just promoting a number.
Exactly. Stars might open the door, but trust is what keeps families engaged long-term.
Let's move into our second story, which focuses on sepsis. This comes from a Baxter-sponsored educational webinar called The Call That Changed Outcomes. The webinar centers on early recognition of hospital-onset sepsis and the role of rapid response teams and code sepsis activation, showing how timely identification, evidence-based decision-making, and fast intervention can significantly improve outcomes.
Yeah, this one really underscores how quickly things can escalate.
What the webinar does well is show how structured response protocols help teams move quickly and confidently instead of hesitating. While it's hospital-focused, the relevance to senior care communities is very real because residents don't experience care in silos. Symptoms often start subtly and may be noticed first in the community.
And senior care staff are usually the ones catching those early changes.
Exactly. Confusion, weakness, changes in appetite or breathing. Those early signs matter. The takeaway for senior care leaders is investing in training and creating clear escalation pathways so staff know when and how to act without fear of overreacting.
That confidence to speak up can completely change outcomes.
It really can. And it also highlights the importance of communication during transitions. When communities communicate clearly with hospital partners, it helps ensure continuity of care and better outcomes for residents.
Now let's talk infection prevention. This story comes from the CDC and focuses on the Targeted Assessment for Prevention, or TAP, strategy toolkit. The toolkit offers a data-driven, three-step framework that helps teams target where infections are happening most often, assess what's contributing to those infections, and prevent future issues using focused, evidence-based strategies.
And that structure can feel like a relief for teams.
Exactly. Instead of trying to address every risk at once, TAP helps teams prioritize based on data. This resource has been around for a while, but it remains highly relevant, and the CDC continues to update tools and guidance that support it.
And infection prevention is still under a lot of attention in senior care.
Very much so. Surveyors, families, residents, everyone is paying attention. For senior care leaders, the takeaway is that using data intentionally can reduce guesswork and stress. When teams understand why certain areas are prioritized, prevention efforts feel more purposeful.
It gives staff direction instead of just more tasks.
Right, and that sense of progress can help with morale and engagement, especially when infection control demands feel never-ending.
Next, let's shift into policy. This story comes from New Jersey Monitor and focuses on proposed legislation aimed at strengthening financial protections for nursing home residents. The bill would standardize admission contracts, limit conflicts of interest in Medicaid enrollment assistance, and reduce the risk of financial exploitation during the admission process.
That admission process is often overwhelming for families.
It really is. Families are emotional, stressed, and trying to absorb a lot of information quickly. Even though this bill is specific to New Jersey, it matters nationally because state-level legislation often signals where regulators are focusing attention.
And financial practices are definitely being examined more closely.
Absolutely. For senior care leaders, the takeaway is to review how financial conversations happen in your community. Are contracts clear? Are options explained without pressure? And do families feel supported rather than rushed during admission?
Those early conversations shape trust long-term.
They do. From a brand perspective, how a community handles finances can be just as impactful as how it delivers care.
Our final story comes from MedPage Today and focuses on the FDA approval of milsaperidone. This new antipsychotic medication is approved for treating schizophrenia and manic or mixed episodes in bipolar I disorder. And the article outlines its clinical profile, mechanism of action, and important safety considerations.
Behavioral health is becoming a bigger part of senior care conversations.
It really is. As residents age with more complex mental health histories, senior care communities are supporting individuals with serious psychiatric diagnoses more frequently. While prescribing decisions sit with clinicians, leaders still need to understand how new medications affect staffing, monitoring, and care coordination.
And staff education becomes critical in those cases.
Exactly. The takeaway here is awareness and preparedness. Leaders don't need to be medication experts, but they do need to understand how evolving behavioral health treatments intersect with daily operations and resident support.
It's another reminder that care complexity continues to grow.
When you step back and look at all 5 stories together, a clear theme emerges. Transparency, responsiveness, and accountability show up in everyone, whether we're talking about ratings, clinical response, infection prevention, financial protections, or behavioral health.
Yeah, trust really runs through all of it.
These stories highlight how systems and policies directly shape resident experience and family confidence. They also show that small decisions in communication, training, and leadership can have lasting impact.
And for senior care leaders, that's both a challenge and an opportunity.
Exactly, an opportunity to lead with clarity, ethics, and intention.
That brings us to the end of this week's HealthCap Weekly Wrap. Thanks so much for spending part of your week with us.
For links to these articles and more insights and perspective on senior care, be sure to check out Angie's blog at healthcapusa.com/Angie's-blog.
We'll see you next time.